Good afternoon, everyone. Myself, Dr. Indira. Today, I'm going to present my study on upcycled smartphone for screening posterior segment disease in the community, bridging the gaps. We don't have any financial interest. So globally, 1.1 billion people suffer from visual impairment. And out of it, posterior segment diseases form a significant part. Only diabetic retinopathy and glaucoma itself are estimated to involve 160 million and 118 million respectively by 2040. But unfortunately, 47 of this population still remains in rural area, and there is delay in diagnosis and referral because of financial barrier, inaccessible healthcare, unavailable trained ophthalmologists. So what is the solution? The solution is screening of posterior segment pathology with a cost-effective method like fundus camera. So there are already studies which have showed that fundus camera can increase the detection and referral of posterior segment diseases both in the campsites and vision centers. So our target was our outreach sites and vision centers. So there are already several fundus camera in the market. Some are tabletop, some are portable, but definitely cost is a factor. So we need an economical solution, especially for LMIC countries like us. And then we came across one device called as AIOC device. It's a brainchild of Samsung and LabST, Korea. So what is this device? The device is made up of a recycled polycarbonate material, and the images are taken from an upcycled smartphone. And only additional need is the lens and 4 rechargeable batteries. So in this study, we compared the graders finding using the AIOC fundus camera images and compared with the pre-operative and post-operative fundus findings recorded our electronic medical record. And we included all the post-op cataract surgery patient operated at our tertiary care hospital visiting our outreach, and exclusion criteria was any kind of media opacity or patients who were not willing. So total of 811 images were obtained from the period of March to October 2023, and the grader was matched to any kind of previous posterior segment diagnosis. So at the outreach site, we updated or uploaded all the patient details like name, age, the address and the vision of the patient and any kind of systemic history, and even uploaded his consent form. And the trained technician took the dilated fundus image. And all the data were uploaded in the AIOC app. So at the base hospital, all this data was downloaded, and the grader opened up all the images and graded it ungradable or gradable and gave a diagnosis. And the investigator compared these findings with the preoperative and POD1 at the EMR record. So graded, either gradable or ungradable. Ungradable was usually because of poor dilating pupil or uncooperative patient. These are the few images taken from the AIOC device. So 811 images were obtained, and more than 93% were gradable, which is a very significant number. 29 cases were diagnosed on preoperative or POD1. But AIOC fundus camera was able to diagnose 52 cases, that is 6.41% of the population. So, and surprisingly, 23 cases were newly diagnosed, including ARMD, glaucoma suspect, BRVO, and macular scar. So this graph shows that how the AIOC fundus camera could detect all kind of posterior segment diseases. So our study detected around 6.41% of posterior segment pathology, and this indicates a high potential for this device for screening, diagnosis, and referral at the early stage. So we already know that fundus camera are user-friendly, easily available, and cost-effective. But our additional advantage of AIOC device is that it's portable, gives good quality image, uses rechargeable batteries, and it's environmentally friendly and reduces the carbon footprint. Our study expresses a transformation potential of an upcycled smartphone as a powerful tool in the community healthcare. Further studies are needed to validate this device. These are my references. Thank you. Maybe we can give back to the society. At the same time, we can be environmentally conscious. Thank you.
Any questions from the judges?
How frequent do you recharge the batteries?
Ma'am, usually for one camp it works, and in one camp we take around minimum of 50 to 70 images we can take.
So one camp, one set of batteries.
Yes, ma'am. Yes, ma'am.